Happy Tuesday. It's me again. It's Myra. We're going to continue with our anatomy lesson. This week is going to be on the tibia and fibula. If you haven't seen the knee anatomy lesson from last week, please go back and review. It will make more sense as I talk about the proximal tibia and fibula, because that is what joins the distal femur to make the knee. So without further ado, let's get started. The tibia is two long bones in the lower leg, connects the knee to the lower ankle. Tibia is also known as the shin bone. Okay, there are several places on the tibia and fibula we're going to be discussing. Let me turn you around and show you anatomy picture of the tibia and fibula. Here we go. As you can see, we have the tibia and fibula. On the left, you're going to see the anterior view. This is the anterior view here. The other side is the posterior view. If you haven't gone and looked and listened to the anatomy lesson about on medical terms, familiarize yourself with anterior, posterior, distal, proximal, so you'll know exactly what I talk about in the direction that I'm speaking of in order to understand what is happening, okay? So we're going to start with the anterior view. At the very top, you'll see we have an intracondylar eminence right there, intercondylar eminence. We also have the medial condyle, medial here, lateral is over here. We also have the head of the fibula right there, head of the fibula. We also have the proximal tibulofibular joint, which means it's the upper part of the tib-fib joint. We have a tibial tuberosity right here. You can actually feel that. If you was to palpate yourself, touch yourself there, what you're feeling, a little bump, is a tibial tuberosity. We're going to come down. You'll see a interosseous, intra meaning enter, inside, osseous bone, interosseous membrane here anteriorly. Coming on down, we still have the fibula. As you can see, it's a long bone, as well as a tibia, long bone here. Going down distally, we have the distal tibulofibular joint. So we have a proximal tibiofibular joint. So we have to have a distal. We have a proximal, we have to have a distal. Here's a lateral malleolus right here. That's in your ankle. You can feel it on the outside of your ankle. So if we have a lateral malleolus, we also have a medial, and it's right here on the tibia. That's on the inside. We have an articular surface right here. This is the talus. We're going to learn about that next week. It's going to be sitting right here, kind of a puzzle piece. It's going to fit perfectly where this little ridge is. Going back up, so we have the tibia, the mid part of the tibia. We have the anterior border. Tibial tuberosity, we talked about, medial condyle. Now we're going to go, this is the anterior. We're going to go over to the posterior now. So we're going to have an articular surface of the medial condyle right there. We're going to have an anterior surface of the lateral condyle, because the fibula is on the lateral side. Tibia is on the medial side. So this is the posterior part of the head of the fibula. Just like over here, it's on the back side right there. Coming down, we have the fibula here, because we have the tibia. Tibia is here, fibula. Going on down, once again, we have the lateral malleolus posteriorly, medial malleolus on the tibia, and the fibular notch is right here posteriorly on the tibia. So that is the anatomy of the tibia. and the fibula. Not much to them, a little bit of surfaces where the muscles, ligaments, and tendons attach. There. Now I'm going to be showing you some pictures, some x-rays of what they look like on an x-ray. This would be, let me come down a little bit. This one would be a normal tibia coming down. Here's part of the fibula right there. Distal would be down below here. Your ankle joint would be down here. As you can see, this is the medial, lateral, fibula here, tibia here. This is the femur, distal femur. This is the knee joint, this little ridge. But what if we have to have surgery? Motorcycle accident, any kind of accident, tumors, anything like that. You might have to have hardware put in. This is a metal rod coming down. I don't show it all the way down to the ankle, but you get the gist. And they put in 2 screws. Evidently there was a fracture here at some point. Non-standing AP just means the patient was laying on their back, non-standing. The x-ray beam was going from anterior to posterior. Once again, if you have not gone and listened to the lecture on medical terms, you please go back and do that so you'll know exactly what anterior, posterior, posterior, anterior, lateral, medial, distal, proximal, all those terms mean. It will help you to understand what we're looking at and the direction that we are looking. Next, I would like to show you what a benign meaning non-cancerous, giant cell tumor looks like. Let me bring it down a little bit. As you can see, I have it circled there. As you can see, the bone is eroded away. The head of the fibula should be here as we go down the leg. As you can see, there is a mass there. This happens to be a giant cell tumor. Giant cell tumor. Giant cell tumors, like I just said, are benign, non-cancerous. They grow at the ends of long bones. Fibia, tibia, fibula, wrist. There is no cure. There is no known reason. It has a 17% mortality rate. In 5 years, 76% of people that have a giant cell tumor are disease-free. I actually had a giant cell tumor in my wrist back in 1996, and it has been 28 years since I've had to have surgery on my wrist with cadaver bone put in, and so far I have been disease-free over 28 years. Also, we need to talk about fractures of the tibia. Fractures of the tibia can look something like this. This is called a comminuted fracture of both the tibia, it's in pieces, and the fibula. So here's the lateral malleolus down here, medial malleolus. That's the talus I was telling you about. We're going to be discussing this bone and others next week on the ankle lecture. This is the tibia, broken, fractured. Fibula again, little piece there going down. Once again, just to review, when I say it's fractured, I mean it's broken. They are intertwined. You can't have a break and not a fracture. Fracture means it's broken. Same thing on this side. This is probably the same patient. Hard to tell if it's the same same patient, same leg. It could be a different leg. It's just hard to know whether it's the same one or not. But once again, here's a fracture there. Here's the upper fibula going down to the ankle. Fracture there. Fracture here. It is probably the same person, same leg, just turned in a little bit. The leg is probably turned a little bit. This is going to be the left leg. I know that because the patient is facing me, which would mean that would be the left side, the left foot, left ankle, left lower leg would be facing me as we do the x-ray. Here's another one. Same thing we just talked about. This doesn't appear to be a fracture. So here is once again the medial tibial condyle, lateral tibial condyle, head of the fibula. Here's the long part of the fibula here. Tibio-fibular joint right here. Lateral malalis down by the ankle. That would be the talus there. Medial malalis going back up. Tibia, once again, the medial tibial condyle. So I hope you've enjoyed the lecture on the tibia and fibula. Next week we'll be going over the ankle. We'll be talking about the bones in the ankle. We'll start the foot as well. There's not much to the tibia and the fibula distally other than talus. So we're going to be talking about the foot as well. So I hope you have a good evening, and I will see y'all again next week. Bye-bye.